Hi, I'm Dr. Mark Weaver. I'm a podiatrist here in Fort Myers, Florida. We're here today to talk about how ankle and subtalar joint, this is the subtalar joint, pronation, will affect the low back, causing pain in the low back at the level of the lumbar sacral and the sacroiliac joints. Let's go look at an x-ray. This is the subtalar joint. This is what they call the symoline. Notice the sickle shape or the S shape caused by these two joints. Now let's look at a chart. Here we have a lateral diagram of a normal foot. Notice the symoline is a straight line, not S-shaped as when the x-ray of the patient with the pronated foot. Now let's look at a three-dimensional bone figure. Here we see on the three-dimensional model the symoline, which is a straight line. This is indication that the foot is not pronated. If we turn the model around, we will see that there's a good high arch. Now, if we flatten the arch out, we will turn the back around and we can see the S shape that you develop with the pronation of the foot. This is the normal foot. Notice that the leg bone is vertical. If we pronate this foot, notice how the leg bone rotates inward. This puts pressure on the outside of the knee. If we look at the skeletal model, we'll be able to see how these forces affect the rest of the body. Here with the full skeletal model, we can see the effects of this pronation. When the foot flattens out, it twists the leg bone inward on the knee. That causes excessive pressure at the level of the lateral knee. Now, the knee is a great joint for strength, but it only has one range of motion, back and forth. It cannot bend this way. So since it cannot bend that way, it directs the pressure of the torques into the leg bone. The next joint to be affected will be the hip joint. The hip is a very good joint. It bends all sorts of directions because it's a ball and socket. In fact, the only direction it can't bend is in and out. So consequently, this pressure cannot be absorbed because it is in and out. The pressure is then pushed into the pelvis, which slides back and forth as a solid unit because the bones are fused. The next place to accept this pressure is the L5-S1 juncture. Since this can't move in the back and forth motion either, it starts to wear this joint out. As it wears this joint out, the motion becomes diminished and you'll start to see herniated discs at the L5 and L4 area, thus resulting in sacroiliac pain and lower lumbar pain. Now we've demonstrated how a small amount of pronation in a small joint in the foot can result in problems with the knee, the hip, the sacroiliac joint, and the lumbosacral joints, all from just a small amount of pronation. Now let's take a look at what we can do about this. By simply bringing support under this area, we can stop much of this torque which makes the other portions of the body deteriorate. We can do this using an orthotic device. The orthotic device functions simply by bringing the ground up to the foot and not letting the foot smash down to the ground. This should help diminish pain in the upper body as well as in the rest of the foot.